about a four-step solution to health care that was presented by Professor Hans Hermann Hoppe. And I'm going to list these four steps. They're going to sound very radical to our listeners because they're very much out of the box, but as we delve into them, I think you're going to find them to be quite important for all of us to understand. First is to eliminate licensing requirements. We're going to talk about what they get replaced with. Eliminate the FDA and government restrictions on the production and sale of pharmaceuticals. Deregulation of the insurance industry is number 3, and the elimination of subsidies to the sick and unhealthy. So let's go back to this first one because this is kind of an eyebrow raiser. The elimination of licensing requirements. Basically, how could we possibly eliminate licensing requirements and make that work, Jake?
Well, I guess I should go a little bit into my personal history. I have a family member who's in the medical profession as pretty much a doctor, physician's assistant, and I myself was a licensed emergency medical technician for I guess about 8 or 9 years roughly.
Mm-hmm.
And as an emergency medical technician, pretty much it's an ambulance driver and commit CPR and treat people. You deliver babies and that type of thing, which I didn't have to do. But on the license for that, how the process works and how all these licenses works, even if you happen to be a lawyer, is you get licensed through the state. And you have they have requirements and set up, and you go through and you take standardized tests and pass or fail. But it's all done by the state, and to some degree, it's actually using state and tax revenues to operate. And it's kind of Hoppe's idea is very, very interesting. And really, what his vision is that not that there's completely no licensing whatsoever, but it's all voluntary licensing. So
I think we have to define the difference between a license, which is something that is awarded by a state, and a voluntary accreditation that is provided by a competing agency. Because we have right now in the United States today, we have non-governmental agencies that actually do provide some protections to the consumers. Underwriter Laboratories is number 1. You look at that, they're the ones that put their little UL on the electrical things. That doesn't come from the federal government. There's dispute resolution between Visa and MasterCard versus the court system we could talk about, things of that nature. So let's talk about the difference between, licensing on one hand, which is where the government gets involved, and voluntary, certifications and accreditations, which no one would disagree is a good idea.
Right, and really you kind of hit the nail on the head, because if you have competing agencies out there, then they'll always be increasing their standards, and they'll also be just the way the free market works, they'll be dropping costs at the same time. And what you'll really end up doing is, to the extent that the consumers care about the reputation, like, this person is accredited by, Underwriter Laboratories for doctors or what have you, or this way. You can set up different agencies, and then you can run itself. And the best part is, you don't have the government involved. And, I like to bring up something called the nirvana fallacy. And the nirvana fallacy is, okay, we have a problem that exists, and why do we believe that the government can actually solve it? They have a very, very, look at Medicare and Medicaid and healthcare right now. They're going to be going broke and within the next decade, period. Like, we need to prepare for it. So, as a politician, we need to start transferring away from the state, look for free market solutions that are cost-effective, will increase care, and lower costs.
Well, one of the things that concerns me most about this whole licensing versus voluntary accreditations issue, which is really off the radar of most people, is that people don't typically understand that when you get into government licensing, what you're really talking about is the government using its power of force to set up a monopoly. And you can have a localized monopoly, which we could call a cartel. And that's basically what we have in medicine right now, because there is vast restrictions on even the number of people that can get into medical school. As I understand it, the AMA restricts a 20-to-1 entry into medical school. And that is to produce what? A protection for salaries for doctors, which are much higher on average. It's $160,000 or more as of 2002. And, compare that, for example, to biologists or veterinarians who get about a third as much. And my personal feeling is that if you're smart enough to be a vet or a research biologist, you're probably smart enough to be a doctor. So these artificial restrictions actually increase costs by reducing the supply of available doctors in our society. And again, this is a particular point that is off the radar of most people. So let's not go ahead and focus on that too much more. We can come back to that later, but let's talk briefly about deregulation of the insurance industry, because insurance, in my opinion, is the thing I hear most. When people say, "Oh, we have a healthcare problem," usually one of the next words that come out of their mouth is insurance. People are underinsured. There's this fallacy of thinking that everybody gets insured, everybody is healthier, everybody's covered, everybody's happy, and so on and so forth. People are ignoring that there are 1,300 companies in the United States today that actually provide health insurance, but they're not allowed to offer it across state lines. Now do the math. That means that you take 1,300 companies that have to basically do business differently in 50 states, even if they choose to do so. That would equate to 65,000 different entities, with each company having to have the infrastructure of 50 different companies, 50 different risk pools, 50 sets of regs, 50 sets of lawyers, and that equals gross inefficiency. And that's going to increase higher insurance costs. And guess who that's passed on to? The consumers. So, it's a complete bogus conversation, and people aren't talking about this reality that if we were to merely eliminate the licensing monopoly that doctors have and that the American Medical Association has over medical schools, and we were to allow insurance companies to compete across state lines, that alone would have a fantastic effect at lowering costs for consumers. Meghan, would you like to comment on that?
Yes, I would just have to say that there's a really great book I'd like to recommend by Dr. Jane Orient, and she talks about just the craziness of trying to work with these health insurance companies because of the HMOs. It's called Your Doctor Is Not In by Dr. Jane Orient, and it was written in the 90s when the Clinton administration was trying to promote their health care bill, and it actually weighs in on a lot of what's going on right now with the Obamacare, and gives you a good history on that from a physician's perspective, and definitely has a lot of more expertise than what I can provide. And I would recommend it because she argues that a free market would bring the best possible medical care to the greatest number of people at the lowest possible cost, which is actually the opposite of what they're trying to say that a free market does. Mm-hmm. So I definitely would have to say that I don't think that forcing everyone to pay for other people's health insurance is going to make costs go down.
I wanted to come back to this point that you brought up earlier in the show, Jake, because what Meghan just pointed out, it touches on a concept called the risk pool. And in insurance today, basically, we don't get to choose which risk pool that we're thrown into. I mean, if you smoke, or if you jump out of airplanes, or if you're a professional football player or a scuba diver, you're going to pay more for insurance. That's typical. But the basic pool, the basic kind of coverage, you're still thrown in with people that the insurance company is trying to cover things that are completely irrelevant to you. And you mentioned, I think you said 18 to 40% of the premium doesn't have anything to do with the average person that's involved in that particular risk pool. Did I hear that correctly?
Yes, that is correct, and that's something that I learned recently, and I'll be adding actually to my. I verified it. I have a contact